Will I need a LASIK enhancement, or is LASIK permanent? This is a very common question that almost all of my patients ask at some point in time, and I have kind of a unique opinion on it because I've been doing this since 1998. I've treated over 80,000 eyes, so I have very long follow-up on some of my patients. First, let me talk about what is an enhancement. That's where it could be done someone anywhere from 6 months to 20 years after their original LASIK if they have a slight residual prescription and we do slightly more laser to allow them to see as clearly as they're capable of. I think there's two basic mechanisms that leave patients needing a LASIK enhancement. The first mechanism is when the initial laser treatment misses slightly. It doesn't achieve the exact 20/20 vision that people want. This is about 2% of people in my hands. They need a slight enhancement, and it increases slightly as we go higher in prescription. That is, you can think of it like a golf putt. The farther you are from the goal, the more likely there is a chance that you'd miss that slightly. So very high prescriptions, high degree of astigmatism or nearsightedness or both increase that risk slightly. So someone with a -2 prescription might only need an enhancement maybe 1 in 500 times, very unlikely. Now -6 with 3 diopters of astigmatism, for instance, that might be as high as a 1 in 10 chance of needing additional laser. The second major mechanism for needing a LASIK enhancement is if someone's eyes change over a long period of time. This seems to occur in about 1% of the people who've had LASIK per year. That is to say, over 10 years, there's probably a 10% chance that you'd need more laser. At 5 years, it's probably around 5%. This is why SharpeVision offers our LASIK for Life plan, so that if you need additional LASIK in the future, we perform it at no additional charge. It's $200 per eye, and it allows you to be assured that your vision will continue to be clear. One must keep in mind that we have several vision milestones, however, as we go through life. These milestones can be described as ocular maturity, or milestone 1, that's age 18 to 45, where your prescription's stable, we still have a flexible natural lens in our eyes, so we won't need reading glasses or bifocals. Then about age 45 and up to about age 60, we call that milestone 2, or lens dysfunction. At this stage, our eye lens becomes less flexible, so you need either bifocals, reading glasses, monovision, or multifocal contact lenses. There is currently no perfect fix for this lens dysfunction that we call presbyopia. Milestone 3 is cataract development, age 60 and up. After age 60, the lens of our eye is not only inflexible, but becomes less clear. The symptoms of a cataract are most commonly noticed when we have trouble driving at night, we see more glare with oncoming headlights, we eventually have difficulty with the activities of daily living. This is called the cataract stage. The treatment for cataract is to remove your natural lens and replace it with an artificial lens called an intraocular lens. The basic answer to how likely am I to need an enhancement over a 10-year period seems to be about 1 in 10. As we age, though, it does not prevent you from either needing reading glasses or getting a cataract and needing cataract surgery. Over those milestones, we move to different vision correction procedures, from lasers to intraocular lenses. Hypothetically, there is no limit to the number of enhancements one could need after LASIK surgery. But in my experience, the risk of that scenario occurring has been 0 to date. So if we treat someone who's 28 years old, then we do another treatment when they are 38 years old, that has generally been enough to keep them out of glasses for their entire adult life. LASIK is such a wonderful procedure for young people because they don't have to worry about presbyopia. I think the best time to have LASIK is in your 20s so that you can enjoy it, you don't have to worry about reading glasses, you save more money long term because while LASIK is expensive initially, you're not paying for glasses or contact lenses. LASIK long-term follow-up is in the millions of people already. Personally speaking, I had LASIK 25 years ago for my nearsightedness, and I was extremely nearsighted, -8. So please come in and see us. Why are you sitting on the sidelines? So many of my patients say, oh, I wish I had done this earlier. I should have done this 5 years, 10 years ago. Now is the time. If you're in your 20s or older, 30s, 40s, 50s, and you want to live a life without glasses or contact lenses, come in and see us. We have the solutions to help almost anybody of any age or any prescription to live their best lives seeing clearly without contact lenses or glasses. We hope to see you soon. Schedule online at sharpe-vision.com. Thank you.